Matt Fitzgerald is a audiologist. He's the chief of audiology here at Stanford. He covers both pediatrics and adults, and he's going to share with us his expertise on hearing rehabilitation. Thanks.
So it's a pleasure to get a chance to speak here today. I love getting the 1:30 slot, because we got the nice post-lunch coma. So this is a perfect timing, and this is great. And, the best part about it, too, is that I can come in and do really evil things to mess up your nap. I know Lindsay said that she's not going to give you a test, but I am going to give you guys a test right here at the beginning. So if you come see me in the clinic, and I'm the guy, or rather my team are largely the people you're going to see when we get hearing tests, okay? And one of the things, so the title of the talk really was, of course, was hearing rehabilitation, but I think what I really want to focus on today is why can't I hear in background noise, and what can we do about it? Because that's the most common complaint of anybody with any type of hearing loss, and frankly, with a lot of people with normal hearing. So if you come see me and I do your hearing test, one of the things I'm going to do is I'm going to measure your ability to repeat sentences in the presence of background noise. So I'm going to play an example of this, so just to give you an idea as to how challenging this could be and how we can measure this. So right off the bat, let's see how this works. And what I would ask you to do is say you're going to hear some sentences, and I want you to repeat them back for me. There's going to be some background noise, and that background noise is going to get progressively louder. And that's okay. Just repeat these sentences back for me the best you can. And let's see how all of you do, and I will be keeping score.
So just the leaf drifts along with a slow spin. The pencil was cut to be sharp at both ends. Down that road is the way to the grain fund. The best method is to fix it in place with clips. If you want audiology to get the raw, more than a few Ontario ever offers research and
Everybody got all of that? Right, exactly. So for the record, the last sentence was a toad and a frog can be hard to tell apart. So if you're 19 years old maybe, or back when we're 19, you could nail this down. But I don't think any of us are 19 anymore. You got all of it? Yeah. Well, we'll talk about that actually. So, again, I like to say, just at a very brief overview, I'm going to consolidate decades worth of research and grossly oversimplify things in about 15 minutes. But I want to talk a little bit about why we have trouble understanding speech when there's background noise. Because I have to tell you, this is the most common complaint to people with hearing loss. And for many of you, this is when you decide to go see a guy like me, or what you're telling people like Lindsay or physicians, this is one of the things you're going to notice. I want to talk a little bit about how we measure this clinically, and I'll talk a little bit about what we can do about this problem now and then what might be coming in the future. So with that in mind, I know your first suggestion is, of course, well, duh, Matt, if I can't understand speech and noise, it's because I have hearing loss, right? And I will tell you that hearing loss is certainly a central part of it. So how many of you guys have had a hearing test before? Maybe, a number of you. Right, because, this is good. This warms my heart. And this is, but as you know, as Lindsay noted and as people have said before, and as I'm going to say, one of the consequences of radiation, of certain types of chemotherapy can be hearing loss. So if you notice a change in your hearing, if you notice your ears start to ringing as you're undergoing treatment, let your oncology team know. They may be able to adjust things, they may not, but this is because the cancer comes first, of course. But let your team know, because they might be able to do something about it. And at the bare minimum, they're going to send you over to at least to my team where we can look at it. So to briefly walk you through this, at the top of this graph are very soft sounds, and we come down to extremely loud sounds here at the bottom. Just like a piano, we go from low notes or low pitches over here, coming across to high notes or high pitches over here. What we call normal hearing in adults, say, is about 20 or 25 or better. I will tell you, we give adults a break. In my pediatric clinic, we say 15. Okay. So in this case, we'd say this person has normal hearing through the low pitches and sloping down here to a severe hearing loss in the highest pitches. So this individual is certainly going to have some difficulties hearing. They're going to have difficulties communicating. And of course, you would say, well, This is why I can't hear in background noise, right? And I will tell you, this is absolutely one of the fundamental factors, but it's not the only thing. So here, I'm a mean person, so not only do I give you a test, I'm going to show you guys a lot of data from our clinic, But this is data actually from about 6,000 patients who underwent that same test of speech understanding that you guys did, and we plotted them by different amounts of hearing loss. So basically what you should take from this are these people have rock normal hearing, and as we go across, we go from worse and worse and worse hearing loss. And anything above this line would be considered to be normal performance. And of course, you got a mild problem of noise, a moderate, or a severe problem of noise. And so you can see, on average, as your hearing loss gets worse, people tend to have more and more problems in background noise. That's not a surprise. Okay, we kind of expect that to happen. But something else I want you guys to notice is you can take people with the same amount of hearing loss, and some of these people can still do pretty well in background noise, and some people fall right apart. Okay? So just because I know your hearing loss doesn't mean we can guarantee how well you're going to do in background noise. And I'll give you a preview. Look at all these people with rock normal hearing who still have trouble in background noise. And our data show that depending on how you define normal hearing, anywhere from 15 to 33% of people with normal hearing have problems in noise. Okay? So, if it's not just hearing loss, what else is going on? I'm a nerd, so, nerdy me, I put this this is a Poirot from a BBC drama, the Agatha Christie monocle, Hercule Poirot. Oddly enough, my son, when we were visiting my grandmother over the winter break, he got really into watching these with Grandma and my Aunt Pauline. And so it was very cute that my nerdy 13-year-old kid was into this. So I thought, well, let's use it here. If it's not just hearing loss, what else is going on in these cases? Okay. So here's a framework, I think, for understanding speech and noise, and frankly, communication in general, when we're looking at other people. And it really comes down to three factors. Now, the first and the most important factor is what we call audibility, meaning, can you hear it? Because if you cannot hear the sound, nothing else matters, okay? But actually, all our data are consistent with what we've known for a long time, is being able to hear the sound is actually only about 50% of your ability to communicate in background noise. It's only 50%. So the other 50% we've described as like, this guy Plomp back in the 60s, 70s, and 80s, he described it as distortion, which is a way of saying something beyond audibility. And we can really break that down into two types. And many of these things are very relevant for the people in this room where you're getting chemotherapy, where you're getting radiation therapy. The first basically is, changes that happen in the signal that going up to the brain. As I'm going to show you, when you lose your hearing, you don't just lose your ability to hear soft sounds. Your brain actually gets a slightly distorted sound relative to what you used to get before. And that's one of the reasons why we can make it louder and you still have a hard time. And the other thing is we call executive function, which is a fancy way of top down. How efficient is our brain at making use of that information that we're getting? And as you heard this morning, we talk about like chemo brain, things of this sort. This is a challenge that we face. And part of our ability to understand and communicate depends on us taking that information we're getting and utilizing it appropriately. So I want to talk a little bit more about some of the changes that happen when we start to lose our hearing. One of the things actually that we're kind of learning now is one of the first things you lose, even before you lose your hearing, you actually start to lose some of the nerve fibers that connect your ear to your brain. Okay? How many of you have ever been exposed to loud sounds in your life? You went to a concert, you shot firearms, something exactly. So data from animal models suggests that when you expose an animal to loud sounds, or actually a lot of you have probably had a situation where I was exposed to something loud, my hearing came down for a little bit, and then it came back up to normal. And so what we found is like when we look at animals, actually what happens is they start to lose some of these nerve fibers that connect to the cells that go to our brain. And then the hearing comes back, but the nerve fibers don't. And there's actually some recent data to suggest that even if you have perfectly normal hearing over the course of your lifetime, you still might lose upwards of 50% of these nerve fibers through the normal aging process. That doesn't matter so much in quiet, but we think it matters a lot when there's background noise. Thing is, there's other changes that happen within our ears. Your ability to tell small differences in pitch gets worse, okay? Your ability to tell small differences in the timing of sounds gets worse. Now, those things don't matter so much if we just ask you to say the word dog. In a nice quiet room, we can do that just fine. But you put a lot of background noise and other stuff in there, that stuff matters a lot, okay? So I want you to understand, when you lose your hearing, you don't just lose your ability to understand speech, okay? There's other things that happen in the ear, and those things influence, frankly, how will we understand speech and background noise. And it's part of why sometimes people say, yeah, my hearing aids don't work. We'll come back to that point. So another thing, what happens, people ask, well, what about the effects of age? Okay. So, as we've known for a long time that as we get older, our ability to understand speech in the presence of background noise gets worse. About the time we hit 40, it starts to deteriorate. And then and basically with each successive decade of life, it starts to shift a little bit more. Okay. Doesn't mean we can't function, just makes things a little bit harder every time. Okay. So again, we're coming back to these points where I'll just bump back up a little bit here. Remember, there's can you hear it? There's how clean is that signal going up to the brain? And how efficient is our brain at making use of that information that we're getting? Okay. All these things matter. Okay. And you as individuals, who've had head and neck cancer and treatments for it, are particularly susceptible to all of these vectors. Hearing loss itself, basically the degradation of the signal going up, and the efficiency of our brain at utilizing what information we are getting. Okay, so I'll jump forward a couple slides. So when we measure this stuff clinically, this is one of my favorite slides because I think if anybody that knows me knows I've been trying to fundamentally change what audiologists have been doing for the last 75 years, because most of the time you're going to get a hearing test and they ask you to repeat simple words in quiet. So you'll come in and say, Dr. Fitzgerald, I'm really having a hard time hearing in a noisy room like this. And I'll take you in a perfectly quiet room and we'll go, say the word bass, okay? So I like to say there's this massive disconnect often to what patients say their problem is and what we're doing. Here, this will underscore, I think, what many of you may experience. So what I'm showing you here is, so what we're doing is we're plotting, this is your ability to repeat simple words in quiet. So if you ever hear, you're really good. If you ever hear, you're really bad. And this is your speech understanding and noise. And if you're at the top, you're really good. But if you're bottom, you're really bad. So what you can see of literally thousands, this is about 6,000 patients, and we have thousands of people who do just fine and quiet, okay, but have a problem understanding speech and noise. And that probably sounds pretty familiar, I imagine, to a lot of people in the room. We're like, yeah, I do fine if we're talking one-on-one. And you put me in a restaurant with a bunch of people, and suddenly everything gets a lot harder. And that's what data like this show. We can do just fine and quiet and have a big problem in noise. And again, I like to bring this up, even if you have perfectly normal hearing, anywhere from 15 to 30% of people with perfectly normal hearing can have difficulty understanding speech and noise. And the last grant I put in, we actually found 10 people in our clinic with rock normal hearing, perfectly normal hearing thresholds, the exact same hearing threshold at every frequency. And they range from being able to do that test I gave at the beginning. Some could do it perfectly, and some people have what we would call a moderate to moderately severe problem on it. So it's a big range, even if it's normal. Okay. So I think for the sake of trying to get us a little closer on time, I'll talk briefly about what we can do about this problem. Okay. And this is really one of the central challenges. So first, of course, as Lindsay noted, and as I'm going to say again, hearing aids are great. Okay. But I bring this up because I want you to understand what hearing aids can do and cannot do. Hearing aids can fix the can you hear it problem, and that's the most important problem. Hearing aids cannot fix how clean of a signal is going up to the brain, and hearing aids cannot fix how efficiently our brain makes use of that information. And this is why some people can get hearing aids and still feel like they have a hard time, because hearing aids can fix the most important part. Can we get the information? But they can't fix the other parts yet. Okay. So my first rule of hearing aids, of course, is we call it audibility, but basically can you hear it is king. People ask me a lot, what's the best hearing aid to get? I will tell you there's very little data to suggest that one hearing aid is better than another. There's a lot of data to suggest that how well your hearing aid is fit to your hearing loss can make a big difference. Okay. And so the key is making sure that hearing aid is fit appropriately. So if you go into my clinic, they're going to stick a small microphone down your ear canal while you're wearing that hearing aid so we can directly measure the output of that hearing aid at the level of the eardrum. And then I know exactly what it's doing. So if you like something or don't like something, then I know what it is. Because otherwise I'm guessing, and I don't like to guess, at least not with patient care. All right. So I like to say if you have a hearing problem, what you really have is a signal-to-noise ratio problem. So you can imagine if I ask you to identify this little red dot right here, and I put some other red dots, but you can still tease it out. But as we add more and more stuff in there, it suddenly gets a lot harder to find that red dot. And that's really kind of the challenges that we face when we have hearing loss, is trying to identify, in effect, what that red dot is, i.e., you want to listen to me, or you might want to listen to Lindsay or Heather or someone else, or your spouse, your loved ones. Now, the hearing aid companies, know that we have problems understanding speech and noise. And we know that right now, as of yet, we do not have a tool to fix or cure hearing loss. Or rather, let me be more specific. I can fix your hearing loss. We could cure it if you're a baby chicken. Okay? If you're a baby chicken or baby mouse, we got you covered. We can regenerate all the cells for hearing. Well, we cannot yet do that in humans. And this is where we come back to hearing aids and things of this sort. And so there's a lot of different strategies, for example, that people are using. So, for example, one of these, your hearing aids actually, they have a microphone that kind of picks up sound around you. And you can have something called an omnidirectional mic, which is basically picking up everything around you all the time. And a lot of times, basically, your hearing aids to try to predict, am I in a noisy place or am I in a quiet place? And if I'm in a noisy place, to say, I'm just going to try to pick up what's in front of you, under the assumption that maybe if you're facing who you want to speak to, that way that's what you want to hear, or we're going to try to make things softer in the back. Okay, that can help to some extent. There are devices called wireless remote microphones, which is like a little microphone that I could put on, okay, and I would wear, and it would transmit sound directly to your hearing aids. And I would say for people who are having real problems understanding speech and background noise, okay, this is one of the best things you can learn how to use and do. So where your hearing aids, you get a little microphone that pairs with it that'll transmit directly to you. So this way, it's almost like I'm whispering in your ear. And most of you probably don't want me whispering in your ear, but theoretically, it's capable. But there might be people you like to have whisper in your ear. So these are widely used in schools. I think they're great things. We would love to have more patients utilize these things. And I would encourage you, if you're getting hearing aids, to consider learning how to use these devices. They're pretty simple. Just put it on your spouse's collar just right here, and then you're good to go. Whoops. Well, I'm going to skip all that. I will tell you one of the most exciting of vistas is the use, you've got, of course, everything is AI now, and you guys hear this. I mean, I know, it's like it's all over the place, and ChatGPT and everything is artificial intelligence. The goal really with this sort of work is to try to say, can we use machine learning or what they call neural nets? Just fancy way of saying, can we train something to recognize what the speech is versus separate it from the background noise? Okay. And in a perfect world, eventually, I think we could even tune this to a specific person. So basically, I could tune it basically so I can hear Heather at all times as opposed to someone else. Look, companies advertise that they're doing this. I don't think they're there yet. I don't think they're far from it. And in full disclosure, these are things that we're working on now too. I think one of the reasons these abilities don't quite work yet is because we don't have good ways to model, say, like all the problems, all the things you lose when you start to lose your hearing. So it's a matter of getting the data to train the model. We're working on that. Okay, full disclosure. So I think for sake of time, one last bit, tinnitus. How many of you have tinnitus? Yeah, exactly. So I have tinnitus myself. 85 to 90% of people will experience tinnitus at least once in their life. There's 10 to 15% of the population that has it all the time. And if you're getting chemotherapy and you have hearing loss or radiation therapy, those things and tinnitus go together like peanut butter and jelly. Super common. Big picture on the tinnitus, a few things to keep in mind. Your primary cause of tinnitus is hearing loss. So people will come in and they'll say to me, well, I think I have a vitamin D deficiency, or I think I have this, or blah, 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 blah. But I'll tell you, almost every time there's some change in your hearing. And even small changes, very small changes in your hearing can make a difference. And what happens in these cases, if you think about it like this, your brain has decades of you're used to getting a certain amount of input. And now when we are getting less input than before because of the hearing loss or the loss of these nerve fibers, your brain tries to compensate. And the way it compensates is we have cells inside our brain that start to fire more often. It's like they're looking for something. And over the course of the time, we hear that increase in firing as tinnitus. I think this is a natural byproduct. How many of you have heard of phantom limb syndrome? Like if you lose your arm, but it's the same mechanism in your head. The reason you can feel that arm is all those cells inside your head, they're firing. They're looking for that arm. So in that case, we feel the arm. In the case of our auditory system, we hear the sound, okay? It's a byproduct of hearing loss. I like to say tinnitus doesn't cause anything. Other things cause tinnitus. And really, I mean, it's a good way to think about it. Tinnitus doesn't cause anything. Other things cause tinnitus. And tinnitus, frankly, can be influenced by stress. And every single person in this room, have a lot of what I like to call destabilizing events in your life. And that's going to exacerbate it. And that's normal. Okay? And doesn't make it easier, but I want you to understand that this is what happens. And of course, changes tension in your jaw, neck, shoulder, things of that sort. And again, if you have head and neck cancer, these are, there's lots of changes and things that can happen there as well. So I want you to understand that you're a group that is particularly predisposed to tinnitus. I would say in many regards, I almost expect it. Okay. And with patients, but I would say to you, just remember, this is a product of your hearing loss and these other things that can exacerbate it. The first step is hearing aids. And the data show that well over 50% of patients who'd wear hearing aids without doing anything else find their tinnitus less bothersome. If it's really bothersome, we see psychologists. And frankly, the other big step, as Lindsay knows, because she refers lots of people, come talk to me for an hour. Let me explain to you. Really, I mean, it sounds goofy, but we have a pretty good track record. If we explain to you what's going on, some strategies about how we can use sound in our day-to-day life, things of that sort, it can make a big difference. Okay. So I think I could talk about this stuff all day long, and I'm sorry, So but let me just say, big picture, I just want you to understand hearing loss is common in individuals, who receive chemotherapy, have head and neck cancer. Tinnitus is common in these situations. This is going to influence your ability to understand speech and noise. It is not the only thing, okay? There's other changes that happen within our ear, that happen within our brain, and every person in this room is more susceptible to those changes. Hearing aids help. Hearing aids will not make you hear like you're 19 years old again. Okay? And it's I always want to say again, what can they do and what can they not do? And just remember that tinnitus is almost always a reflection of your hearing loss and can be exacerbated by stress and other changes that are happening within the head. Okay? And if you have other questions going forward, Heather can put you in touch with me. I'm more than happy. I know I've seen at least one person in this room before, and I'd be happy to answer any other questions that we have. Thank you.